Hello and welcome to week 2 already. Wow, we are zooming through this. Well, it kind of helped that week 1 was only half a week, but regardless, you all are headed toward graduation and national certification and the beginning of a long and successful career as a medical coding specialist. This is such important work. And remember, being on the administrative side, you are still an incredibly important part of the patient care team. Because after all, we have our hand on the revenue stream that comes into the facility, whether it's a doctor's office, a clinic, or a hospital. And you already know that without money, we cannot provide proper care for our patients. Also, the job we do on claims and coding on claims will determine whether those claims get paid by the third-party payer or not. And if it's a not, the patient may have to pay out of pocket. The patient may have to pay out of pocket. The patient may end up filing bankruptcy, losing their house. It's terrible, all because we made a mistake, which is why national certification is so very important, because it gives you that solid, objective evidence that you know what you're doing and you do it well. And that goes a long way with prospective employers, as well as your skills moving forward in your career. Okay, so this week, our topic is, why does a coder need to know medical terminology, anatomy, and pathophysiology? I think you're finding already, or you have found in your going through your coding courses, how important this is. Because remember that our job is to interpret what the physician documented into another language. And that language may be ICD-10-CM, ICD-10-PCS, CPT, HCPCS Level 2. We're the ones that need to determine that, and we must be accurate. And if you don't know what you're reading, how can you interpret it into another language? It's so difficult. Imagine the physician you're working for is writing in Portuguese, because that is her native language. Okay, well, that's fine. But if you don't know Portuguese, how can you possibly do your job? It's the same thing: medical terminology, anatomy, pathophysiology, pharmacology, as you know from your previous courses, makes a difference in your ability to do your job. Now, why am I talking about this? Because you've already taken anatomy and pathophysiology, you've already taken medical terminology, and you've been using all of this over and throughout all of your coding classes and your other courses, and that's true. But as you prepare to sit for the national certification exam, we want to make sure that you're not forgetting things. You know that old saying, if you don't use it, you lose it. So I just want to reinforce the importance of keeping these skills and this knowledge sharp and up to date. So, for example, we have a case study. Arlene suffered a CVA, a cerebrovascular accident with sequela of aphasia. Once she was ready to be discharged from the hospital, she was transferred to another type of facility for physical and speech therapy, expecting it to take about 4 to 6 weeks until she can go home. Okay, well, that's fine. What this involves is you remembering exactly what a CVA is and sequela of aphasia, what aphasia is. And remember, aphasia is one of those terms. Sounds like aphasia spelled differently with a G, right? Aphasia with an S is related to speech. And you have a clue here because she's going for speech therapy, as opposed to aphasia with a G, aphagia, which is a problem swallowing, in which case she would be going for physical and a feeding tube and being weaned off the feeding tube. Okay, so again, you can use all the information in the case study to support your ability to understand. And that goes beyond what is already in your coding manuals, because your coding manuals often will give you definitions. You can also tell about things with regard to what subsection that code might be, as indicated by the index, the alphabetic index. Okay, so there are lots of clues right there at your fingertips. And don't forget about the guidelines in your code books, which will also provide you with a lot of information, as well as, ready for it, guidance. The guidelines will give you guidance. Okay, so here we have a cerebrovascular accident. This is what's known as a non-definitive diagnosis. It's the sudden death of some brain cells due to lack of oxygen when blood flow to the brain is impaired by blockage or rupture of an artery in the brain. Okay, now when there's a blockage, that's one kind of CVA. If there's a rupture in the artery, then what happens is that's a hemorrhagic stroke or CVA. And that's like really not good. Okay, the blockage can be relieved and sometimes alleviates itself. Okay, but a cerebral infarction is very different. Well, maybe not very different. A cerebral infarction, also known as a stroke, which is a lay term used for CVA as well, so we have to be careful. This is a lesion in which a cluster of brain cells die when they don't get enough blood, and technically oxygen from that blood. Okay, so an infarction has the death of cells, but so does a CVA. These are very, very close in their meaning. Okay, so we go back to the diagnosis, and don't forget your medical dictionary. Okay, so when you look this up, you can see that you have a choice of two codes for this primary or principal diagnosis code. I69.320 aphasia following cerebral infarction. Yeah, but that's not what the note says. Or I69.920 aphasia following unspecified cerebrovascular disease. Cerebrovascular accident is what you read in that one sentence, right? But we must be able to distinguish between these two. So if you go back to the notes, and let me emphasize, okay, this is probably what would be on the discharge summary. You need to go back to the full documentation and read everything that the physician wrote about this patient's situation to determine, okay? Or if you will remember the magic word query. Now, you might say, well, I'm in the middle of an exam. I don't think they're going to let me query anybody. And you're right. Okay. So I want you to be thinking about that. And remember that this exam is all multiple choice. So the good news is you have a preset of 4 options to choose from. Okay. Sometimes one of the answers may be query the physician because there's not enough information. Sometimes that is not the correct answer. Sometimes it is the correct answer. Sometimes, okay. But remember, we have to be careful to not edit, to not assume, to not put our own knowledge and information into the documentation. I hope that helps you. Okay. All right. So the answer, CVA is generic. You want to check the rest of the chart to determine if an infarction was documented. If necessary, query the physician. Look at that. I already knew the answer and I didn't even know I knew the answer, but I was telling you the answer before I looked at the answer. Okay, yes, it's true. I created this PowerPoint presentation, but the fact is this is still the right thing. So if you have no access to any more documentation, if you are in the middle of an exam and you cannot query the physician, then you're going to look at the unspecified code because that's exactly what you have. There is no infarction specifically documented. You cannot code an infarction as if it were, even though you know about the commonality of cerebral infarction and a CVA, both identifying the death of certain cells in the brain. Okay. All right. So what's the point? The point is this week you are going to read the chapters in your book, reviewing anatomy and medical terminology and pharmacology. And don't skip this. I know it. I got an A in anatomy and medical terminology and medical terminology. That's great. That's fine. We love that. Okay. But just remember, if you don't use it, you lose it. You need to sharpen all your skills because when you do, it has a domino effect on sharpening and improving your coding skills. And you already know that, don't you? Yes, you do. And if you didn't know it before, you know it now because I just told you. Okay. And trust me, when I tell you, this is the foundation of coding. And when you look things up in PCS, I love PCS, ICD-10 PCS. It's a little easier. You have a lot more definitions, but also remember that ICD-10 PCS uses different terms for similar actions than CPT. Okay. So you want to make sure that you are reviewing the terminology as it's used in ICD-10 PCS. Oh my gosh, what are you going to do? It's all right there in your code book, in the front and in the back. It's all right there, giving you specific definitions, and within the tables, like the root term, the root operation term, the definition is right there at each table. You just have to read it. Slow it down. Don't assume. Now, yes, I know the test is timed, but you have to work meticulously. And the reason why I'm telling you this in week 2 is this is something you need to practice. Okay. You need to go step by step. And I know your urge is to run because you're being timed, but you're going to go one step at a time. And as you practice this now, by week 8, when you're ready to sit for the exam, you will be able to do this. Okay. Practice being meticulous. Use your finger, use the information in your code books because they're there to help you do a good job. I know. All right. You're going to have a quiz covering both chapters. Okay. Don't use your textbooks so you can really check your knowledge. Remember, this is all about this course. This entire course is all about two things: preparing you for that national certification exam and preparing you for a successful career. Now is the time to find out what you know and what you don't know, so we can bolster that knowledge. You can do more reviews. You can talk to me and I'll go over more things. I'll give you handouts. I'll point you in the right direction. Okay? Okay. After you do the quiz, you're going to go back and you are going to do the analysis. Every question you got wrong, you must do your analysis and figure out what the correct answer is and where you went wrong and how to correct your thinking or your process to get it correct the next time. This is so incredibly important because we learn our best lessons from our mistakes. If you don't use this to learn from your mistakes, then you're bound to repeat your mistakes. And that's not a good thing. It's not a good thing on the certification exam, and it sure as heck is not a good thing when you're on the job. I promise you. And then I will go through your reviews and give you feedback on it, okay? And take this part seriously, because this is an incredibly important part of your learning, okay? All right. And if you have any questions after this, email me. Okay, there's additional stuff in the content, a handout on understanding medical terms, all about drugs, the good drugs, and pharmaceutical basics, because don't forget, you're going to have situations where they're going to say, we gave the patient this medication, and you have to know what type of medication that is. Is it a sedative? Is it an analgesic, pain relief? You got to know. It's part of the process. All right. Any questions? Anything? Anything? Sometimes you just got to talk, and we can email back and forth. We can make an appointment to speak on the phone. We can set an appointment up to Skype to do a one-on-one Zoom, to do FaceTime. I'm very technologically flexible. Most important, I'm here to support you. I promise you a response to your email within 24 hours. I'm here to help you. Okay, great resource. Have a wonderful day, and I will see you in the course.